This training is foot care for C.N.A.s. There are 3 sections for this training. There is a PowerPoint that you're now watching. You have a video of foot care given in the bed, and you have a post quiz. The importance of foot care is that it will help prevent infection, skin breakdown, complications, promote mobility, enhance early detection of circulatory issues, promote dignity, and promote quality of life. This education is essential for C.N.A.s to ensure the safety, mobility, and overall well-being of the residents in long-term care. C.N.A.s are trained in foot care, can identify the signs of disease process, and aid in providing education to residents on routine foot care. Neglecting foot care can lead to serious complications that affect both the health and independence of your resident. Foot care should be provided daily and inspection of the feet daily. When we mention that foot care prevents infection and skin breakdown, regular foot care helps identify and prevent issues such as fungal infections, ingrown toenails, calluses, blisters, and pressure sores. These are all common problems that can easily escalate if left untreated. Having good foot care helps promote comfort and mobility. Clean, well-maintained feet reduce discomfort during walking or transfers, which will encourage activity and help maintain strength, balance, and independence of your resident. It also supports early detection of circulatory or neurological issues. Caregivers can be trained in proper foot care. They can spot the warning signs like swelling, discoloration, numbness, or slow healing wounds, allowing for early intervention and prevention of much serious complications. Good foot care also enhances the dignity and quality of life of your resident. Routine foot care shows respect for your residents' personal hygiene and well-being. But taking time to care for their feet can improve their self-esteem, emotional comfort, and trust of you, their C.N.A. caregiver. When performing foot care, a C.N.A. should always observe for the following key points to ensure proper hygiene and patient comfort. Inspect for all abnormalities. Look for redness, cracks, blisters, or swelling of the feet. Avoid trimming the toenails. This is a task for licensed nurses or podiatrists. You may file straight across if need be. Do not apply lotion between your toes. This is to prevent a fungal growth. Report any changes or concerns, sores, infection, pain, to your supervising nurse. Handle all diabetics with extra care. Avoid hot water and refrain from the nail care due to higher risk. Ensure infection control and proper hand hygiene. Wear gloves. One of the main complications of feet is fungal infections. This is a common infection of the nail. It begins as a white or yellowish-brown spot under the tip of your fingernail or toenail. As the fungal infection goes deeper, the nail may discolor, thicken, and crumble at the edge. Nail funguses can affect severe nails. Don't ignore the odor. They have a distinct odor of fungus. Reviewing the symptoms again to observe for is thickening, discoloration, brittle, crumble, or ragged nails, misshaped nails, separation from the nail bed, and very smelly. This is a picture of the early stage to moderate stage of a fungal infection in the nails. This is the reason we must make sure we keep our feet clean. Wear dry socks. Always dry the feet well. Make sure you dry between the toes and rotate shoes. Moisture of the shoes can also cause fungal infections. Another common infection of the feet is athlete's feet. This is an itchy, stingy, and burning feet. The toes may be signs of athlete feet. This contagious condition appears after you make contact with fungus, usually in wet environments like locker rooms, public showers, and swimming pools. You may also experience foot blisters, crumbly toenails, cracked, dry skin, or even raw skin on your feet. This is a good example of the athlete's foot as the importance of why we need to keep our feet dry. Don't put lotion around your toes. Dry between the toes well. Always ensure clean socks and keep the showers clean. Another common complication of foot care is ingrown toenails. A toenail that grows into the surrounding skin are known as ingrown toenail. These can occur if you have nails that are curved, poor trimmed, compressed toes, or an injury to your toes. Genetics also plays a role in ingrown toenails. Mild cases of ingrown toenails can cause discomfort and tender skin around the nail. More severe ingrown toenails may not heal on their own or become infected and result in redness, bleeding, pus, and pain. These are two pictures of different stages of ingrown toenails. The first one has the swelling, redness, and irritation of an infection. The second one actually has part of that toenail going into the skin. This is an important reason of why we cut nails straight across and don't circle them or cut down into the quick. Another common problem with nails of foot care is blisters. This is a small fluid-filled bubble filled with what appears to be a clear liquid. It appears out of nowhere, causing discomfort with every step. Some key reasons that cause blisters is friction. This can be a severe issue that can lead to from repetitious rubbing that causes blisters, such as the heels rubbing on the bed. Improper fitting shoes, footwear that are either too tight or too loose and allows your foot to slide or rub against the material. Moisture. Sweat makes the skin softer and more susceptible to friction. Socks that don't wick away the moisture like cotton can make the problem worse. New or stiff footwear breaking in a shoe can often cause blisters. Foot deformities such as bunions or hammered toes or bone spurs can create pressure points on the foot, causing blisters. This is an example of heels with blisters from friction. This is from the pressure of a bed. Residents that sit up a lot, they slide down in the bed, which causes the feet to actually slide down. Some residents actually get it from the covers on their toes. It's important that we float the heels, wear heel protectors, and if the resident is sitting up in bed, raise the foot of the bed slightly. That will help prevent sliding. We also can use a foot cradle at the foot of the bed to keep the top sheet and blanket off their toes. One of the things we do for preventing breakdown on their heels is floating a heel. Now, if you'll look at the picture, you will see that the leg and under the knee is properly supported with the pillow, but their heels are not touching the pillow or the bed. You should be able to slide your hand underneath their heel and it's not touching anything. Putting the heels on top of a pillow is positioning. It is not floating heels. So be sure to observe your care plan and your Cardex. And if the residents have floating heels, be sure that the heels do not touch the bed or pillow. The pillow should reach the ankle and no further. We also use a lot of heel protectors. This is a picture of two different types of heel protectors. Just remember, for safety, they cannot stand and walk in heel protectors. These are used in bed to prevent pressure and positioning of that foot. You know, foot care is very important. We want to make sure our water is not too hot, just warm. So check the temperature and allow the resident to check the temperature of the water. It is recommended to have the resident sit up for foot care when possible. This is because you need to soak their feet for 15 to 20 minutes in the warm water, and they can soak easier if they're sitting up in a chair or wheelchair. Laying down is very difficult and uncomfortable for that resident to soak their feet in water for 15 to 20 minutes. But this actually softens the feet and skin, allowing you to clean them better. Each area of the foot should be washed with a clean area of your washcloth. Don't cross-contaminate. Ensure you wash, rinse, and dry between the toes really well. Lotion is applied to the entire foot, avoiding the toe area. Putting lotion on the toes increases moisture and leads to fungal infection. You also want to pat the lotion dry to ensure that they do not stand and slip. As you move forward to do your foot care, there are some basic supplies that you do need. You will need a barrier. You can use a towel on the floor, or you can use a chuck. You will need a towel for drying the foot. The foot that you dry with is not your barrier. You may also wipe the lotion off with the same towel that you dried the feet with. Wear gloves. You need a bath basin, warm water. You need soap and lotion, clean socks and shoes, and a minimum of 2 washcloths, one for each foot. You're ready to move forward with this training. The next step is watch the attached video and then take the post test. Good luck.